To best serve the patient, it's imperative that the healthcare provider obtain an initial medical history from the patient. Even though the patient's health history is oftentimes updated while waiting in the waiting room, don't assume that anyone's reviewed it. A formal interview allows practitioners to further question responses and make an assessment of the patient's pain or anxiety level. If the patient's underage, then the interview must be completed by the parent or guardian. Information to collect specific to sedation should be learning about any disease, disorders, abnormalities of major organ systems, and reasons for any hospitalizations. What's their pregnancy status? Have they had any adverse experiences with sedation or analgesia? Do they have any drug allergies? What current medications are they taking? And keep an eye open for any potential drug interactions that may be contraindicated for the use of nitrous oxide. Ask them about their tobacco, alcohol, or substance use or abuse. Other questions could be about their fears or anxiety they may be feeling towards dental work. Let them explain any past experiences. Have they ever used nitrous oxide or any other conscious sedation for dental treatment before? Remember that some people don't have a problem communicating their anxiety or fears, but others might. They may show outward signs, though, that relay their nervousness, such as sweating, shaking, or syncope. Vital signs are going to include pulse, respiration, and blood pressure. Oxygen saturation levels are recommended or required for moderate and deep sedation and general anesthesia in most cases. Some offices use this even when giving minimal sedation. That's okay. It's very easy to do and it takes no time at all. The vitals should be taken before and after the administration of nitrous oxide sedation to establish health and a preoperative baseline and an objective measure of recovery at the completion of the treatment. Once the before and after vitals are taken, they can be compared for their degree of variation. Patients with normal pre-hypertensive and hypertensive blood pressure may have nitrous oxide. The relaxation effects that nitrous brings may actually help with minimizing any increase in blood pressure that nervousness might bring. But for those patients with extremely elevated blood pressures, it's recommended that they just see their physicians right away and postpone elective procedures until it's under control. The operator of nitrous must be prepared to manage the complications associated with the next or deeper level of sedation beyond that which was intended. So for the dental hygienist, that means moderate sedation. Obtaining informed consent is a mandatory component of the procedure. Without it, treatment cannot commence. Give the patient verbal and possibly written instructions before administering sedation. There are several components of informed consent that should be covered to ensure that the patient completely understands exactly what will be taking place. They are a thorough explanation for the purpose of the procedure. Usually it's because of dental anxiety. A review of how it will be accomplished, what to expect, what are the benefits and the risks, and an opportunity to ask any questions. Thoroughly explain what procedures will be performed that day. They should understand the intent of the procedure and the indications for its use. Explain to them what to expect during the procedure and an overview of the signs and symptoms they can expect. Patients don't need to fast prior to conscious sedation, but they are encouraged to avoid fatty, fried, or greasy foods just prior to the procedure. A light meal of carbohydrates is better eaten about an hour or two before the appointment. Vomiting shouldn't be a problem if nitrous is administered appropriately, but sometimes if there are frequent, significant fluctuations during administration, then vomiting might occur, especially for those patients that have a propensity to vomit. Highlight the benefits of nitrous sedation, but also any risks that may be associated with it. This informed consent must be obtained from a competent patient or a legal guardian for each time that it's administered. During nitrous sedation, it's important to continually monitor your patient. By doing so, you'll ensure that your patient's responding well to the drug and you can recognize any adverse reactions quickly. Periodically, monitor your patient's level of consciousness by asking questions and assessing their responses. They should respond quickly without slurring their speech or other signs associated with moderate sedation. Monitor their breathing by keeping an eye on the reservoir bag. It'll show the frequency and the depth of their breaths. They should be regular and full. If a pulse oximeter is used, this can monitor any dangers of hypoxia or low blood oxygen. Titration is a method of administration of a drug in incremental amounts until the desired endpoint is reached. Administering a drug this way provides only the amount of drug necessary for the procedure being performed. Other drugs that lend themselves well to titration is IV sedation. Other routes, such as oral, transdermal, or intranasal, there's no way of controlling the absorption rate of the drug. Nitrous is given in incremental doses until a patient's reached a comfortable, relaxed state of sedation. If titration is done properly, the patient won't receive any more of the drug than's necessary. It avoids overdoses and minimizes the chances of a severe, possibly life-threatening reaction should the patient be allergic to the drug. Now, keeping in mind that there have not been any reports of an allergic reaction to nitrous before. Titration also allows for biologic variability. No two individuals react the same in response to a drug. What's effective for one patient won't be effective for another, nor will individuals respond the same way on different days. There are hyperresponders and hyporesponders. A hyperresponder will be someone who reacts quickly to the drug and begins to show signs and symptoms early on in the titration period. A hyporesponder is a patient who doesn't respond quickly at all. These patients will continually tell you that they don't feel anything. You have to assess them for the signs and symptoms you know should be there and be prepared to top nitrous out at 50% regardless of what the patient says, because anything over that is considered moderate sedation and you won't be certified to give that much. It's important that while you're titrating to adjust the levels appropriately. That's one of the best things about nitrous is its ability to adjust the levels of sedation so quickly and predictably. You can turn it up when giving injections and then turn it back down when you're done. Remember, because of biovariability, patients will require different levels of nitrous on different days and for different procedures. A common mistake made with nitrous oxide sedation is to automatically deliver a preset percentage of nitrous to every patient. Every patient, and even the same patient on a different day, will require a different amount of nitrous and oxygen levels. Negative patient experiences from nitrous use are usually because the patient was oversedated as a result of operator error. Proper titration of nitrous will bring a patient to their proper level of minimal sedation using the appropriate amount of drug for them on that day. Certain physical, psychologic, and physiologic effects may manifest in individuals when they receive nitrous and oxygen. It's important to recognize those signs so that you know when your patient is at their appropriate level of sedation. The physiologic signs to look for will be your patient will look relaxed and comfortable, showing a happy, pleasant, and satisfied demeanor. They'll most likely acknowledge a reduced sense of fear and anxiety. Their shoulders will drop and their arms will rest loosely on the armrest. The eyes are a good indicator to monitor their level of sedation. The movements will become slower and they'll blink less. Their lids will feel and look heavy, and they'll want to close their eyes. Their facial expression will take on a flat look rather than an alert one. They should show an absence of tension with a relaxed forehead. They'll often smile easily and giggle. When sedated properly, patients will be fully conscious and aware of their surroundings. They don't feel threatened and they have a sense of well being. They respond rationally and coherently to questions and directions, and they're able to carry on conversations. What's great is that their protective cough and gagging reflex is still intact, though it is slightly diminished. Now, you want to be sure not to pose leading questions that suggest certain symptoms, such as asking the patient if they feel a tingling in their fingers, toes, cheeks, lips, head, or chest. Not all patients experience this, and suggesting it may make a patient think that they aren't being affected by the drug if they don't feel those. So simply ask them to explain what they're feeling. Where some patients may feel a heaviness in their thighs or legs, others may feel light, others still may feel warm. As mentioned earlier, you need to know the signs of oversedation so that you can keep your patient in a minimal sedative state. Signs of oversedation include an intensified tingling, a sudden uncomfortable feeling in which the symptoms are intolerable, dreaming or hallucinating. Patients may attempt to respond to voices. For some patients, sexual fantasizing may occur. Restlessness, fidgeting, or combativeness can also occur. If a patient begins to show sluggish motions or is unable to move their extremities easily, then they're probably in moderate sedation. Their eyes can become fixed and non-responsive, or they may not be able to open them at all. They may want to just go to sleep. If a patient goes into a fit of laughter, then they begin to breathe through their mouths, which causes them to take in more of the room air. When this happens, they don't breathe as much of the nitrous oxide, which will bring them back down into a lower sedation state. When the patient calms down and begins to breathe through their nose again, then it all starts all over. So it's important to turn the nitrous oxide down. Sometimes a patient who's above minimal sedation will no longer feel that they're in the same surroundings. They can have a sense of detachment or disassociation from the environment and may feel like they're floating, flying, or having an out of body experience. Other signs and symptoms can include an uncomfortable warmth, very drowsy, slurred speech, incoherent sentences. They don't respond well to verbal commands, dizziness, lightheadedness, a spinning sensation, tingling through their whole body, vomiting, or unconsciousness would be signs of a moderate sedation, and then you would need to immediately turn the nitrous down and the oxygen up.